I'm called Agenes Bakuchandia. I always say I'm Madam ABC. I'm a nurse and a midwife, and that's why I'm the chief nurse for the nurses and midwives for this country. In the study, you will understand in that perspective, but our titles here is called commissioner. So I'm in charge of nurses and midwives in this country, and I'm proud that we are the movers and shakers in health facilities. There's no health facility which can be there without a nurse or a midwife. They are the most committed, especially the midwives, and I'm happy this is a maternity center. Before I speak, I also want to really give you greetings from my top management and the good leadership. You have echoed it well, that the permanent secretary has been here, and my honorable minister is a player and is having a good network, and that's why in health we have moved so far. This is a very bad period because the honorable ministers are playing their ground, and the PS is now standing in for some of those gaps in meetings, lobbyings, and attending even the cabinet. So greetings from the Director General. They are equally very busy, but because we are there to support the system, I have been able to be identified to come here and represent them. And I believe I will do it again. And I also want to thank the leadership of this country. All this is coming because of vision of someone. That is excellence. If you have hands, please put it together and clap. Because of his elaborate vision, he has made health as one of the key developmental issues in this country. And through him, we are able to develop a national development plan which has us to take us through 2040. If you go there, health is one of the key transformational issues which could be able to empower the people of Uganda to be able to be productive. And if you have hands, please clap for that. I'm only reminding you of how these health systems come in place because it is not from nowhere. Nevertheless, as Minister of Health, we are there to carry this mission and vision of the 2024. And how did it come to that? Through the manifesto of this NRM, they are clearly stated that they are going to secure the health of the population of Uganda. And as Minister of Health, we are able also to have a vision which is clearly transforming the National Development Plan, and we are saying our vision is to have a healthy and productive population that could contribute to socio-economic growth and national development. Are we together? Yes. I want a hand clap if it is clear. So our vision as ministry, we want to have healthy population. And within this, what have we so far achieved? Through the Vision 2040, this country declared that they are going to have access. They will improve access to health facility for the population of Uganda, and that health facilities will be in a radius of 5 kilometers. And as I speak now, the health facilities we have built is about 91% of the population are able to access health facilities at 5 kilometers. That's a very great achievement. With only few other areas which are hard to reach, like Karamoja, like in cattle corridors, that 9%, I believe the next 5 years, every person in this country will be able to access health facilities at the radius of 5 kilometers. We have gone ahead as Minister of Health in the area of specialization. We have regional referral hospitals. The number of regional referral hospitals has now increased up to 16. And you have one here in Bali, which is a regional referral hospital. A regional referral hospital has specialized care. And these facilities, Health Centre IIIs, Health Centre IVs, are supposed to handle these other normal cases, leaving only those who require specialized care to be in the regional referral hospital. And we are so glad that through the partnership, we are able to now change this to Health Centre III, which is very functional and also with the comprehensive services for maternal child care. Thank you for the team for that. Not only that, we also have specialized hospitals. As a country now, we are looking at the disease burdens. We have a specialized health facility for cancer. And these specialized care and services are even now being extended to the regional referral hospital. Mbale is one of them, and we have already started the process of having fully-fledged cancer services within the regional referral hospital. In Arua, in Barara, we are starting with those. Those are progresses, because these cancer diseases is now everywhere. And we feel we should be able to even embed them in this regional referral hospital. Not only that, we have Heart Institute in Uganda. And this Heart Institute is able to work with the regional referral hospitals. They occasionally come, they carry out camps to address those issues. Not only that, we have as a country, we say every constituency
blessing you. And thank you for even finding other partners, that this facility would be a white elephant if it did not have the equipment. Now you went ahead and said, no, these are high-ranking people, but I can still speak to them. They can even come and visit the facility. You lobbied for us, the black people. Oh my God. May God richly bless you. People come to this nation to invest. And when you invest, you get profit.
You cannot send her home. So make priority. As I said earlier, I'm a nurse and a midwife. I worked in the facility for 18 years before I went to Ministry of Health. And I worked in maternity for 10 years, 14 years before I worked as a nurse, 8 years in other areas. So you can make priority, but make sure we protect our mothers, we respect them, we really give them that honor to appreciate and also love our facilities, because these facilities are for them. When they don't come, when we don't respect them, when they come for maternity, when we don't give them that right to really know that they have right to come, right to ask what services, they will cease and they will remain at home. And when they remain at home, they will become also account for the statistics of those who go on the other side of morbidity or mortality, which we don't want to see. And with all this, thank you everybody. I'll take the message, and our PS is a listening PS. Our PS is a lady of action, especially all the top management. I will give her the report, and as Minister of Health, we shall be able to discuss that. As she came here and commissioned it as Health Centre III, I am very hopeful she will be willing to come back as these honorables, because our hands are always tied. When we put it before them, they dilly-dally. And then they start, others one's mine first, the other one first. But please, have network in your members, have trust in them so that they are able to give, because our elevations also depend on funds which are available. We may want to do it. If the funds are not available, we can't do it. But with funds available, we are willing. Why not? Because when we elevate, this comes with more human resource. It comes with more super specialization. It comes with quality of care. So with all this, when we brief her, we are committed. I said we are committed as Minister of Health to support this facility in all the ways of what we could to make sure that the facility offers quality care in relation to what we would love to have for this level. And want to say thank you for honoring, thank you for loving our partners, thank you for your commitment as individuals.